गुरुर ब्रह्मा गुरुर विष्णु गुरुर देवो महेश्वरा गुरुर साक्षात परम ब्रह्मा तस्मै श्री गुरुवे नमः। अखंड मंडलाकारं व्यापम येन चराचरं तत्पदं दर्शितं येन तस्मै श्री गुरुवे नमः। This is Mohini Verma. A very warm welcome to all of you on this auspicious day as we gather here to celebrate the National Statistics Day. I am honored to be your host for this special webinar, where we will delve into the fascinating world of statistics and its significance in shaping our society. Today, as we celebrate the birth anniversary of the great statistician, Professor Prashant Chandra.
Prasanna Chandra.
Today, as we celebrate the birth anniversary of the great statistician, Professor Prashant Chandra Mahalanobis, we pay tribute to his monumental contribution to the field of statistics in India. The title of our webinar, Unlocking the Value of Statistics in Healthcare, Transforming Data into Actionable Healthcare, is a testament to the transformative potential that statistics hold in various aspects of our lives. In the words of Professor Mahalanobis, statistics is a grammar of science. Today, we have the privilege of delving into the grammar and unraveling its beauty. Before we commence our session, I would like to extend my heartfelt gratitude to all the speakers who have graciously agreed to share their knowledge with us today. Sir, I am audible?
Yes, you are audible.
Okay, sir. Lastly, I want to express my appreciation to each and every one of you and the participants for the joining us today. Your response and active participation are what make this event a true success. Thank you. And now let's start the webinar. Now, I would like to introduce Dr. Shubham Pandey, sir, the National Coordinator of the Dr. Padam Singh Research and Development Scheme and organizer of this webinar. Sir is currently serving as a National Coordinator at Institute of Applied Statistics. He has served as Assistant Professor of Ops and Gynae Department at GSBM Medical College, Kanpur. He has also served as Assistant Professor and Head of Biostatistics Department at Himalayan Institute of Medical Sciences, SRHU, Dehradun. He has served as Senior Statistician in National Retinoblastoma Registry Program at National Institute of Pathology, Indian Council of Medical Research, New Delhi from September 2013 to October 2013. And he is a Master Trainer of Family of International Classification, ICD-10 and ICF, Central Bureau of Health Intelligence, Ministry of Health and Family Welfare, New Delhi. Now I would like to invite Dr. Shubham Pandey, sir, for welcome address to everyone. Sir, please.
Thank you, Mohini.
Namaskar.
On the behalf of the organizing committee, I extend a warm welcome to all of you on this great occasion of National Statistics Day and the 130th birth anniversary of Dr. P.C. Mohanablis. I am Dr. Shubham Pandey, one of the organizers, and it is a privilege to stand before you today. We are gathered here today to celebrate the remarkable contribution of statistics and their profound impact of the field of healthcare. Our online webinar entitled Unlocking the Value of Statistics in Healthcare, Transforming the Data into Actionable Healthcare bring together professionals from the various fields who share the common goal, the power of statistics drive the positive change in the health practices. Statistics play a very important role in the healthcare to guiding evidence-based decision making for accurate diagnosis, predicting disease trend, and evaluating the effectiveness of any treatment protocol. In an era of vast amount of the healthcare data, statistics help us unlock valuable insight, identify the pattern, transforming the raw data into the actionable information, and they improve the patient outcome and enhance the delivery of the healthcare services. Throughout the webinar, we have lined up the series of the enlightening presentation, engaging discussion, and interactive workshop that will relieve the various facts of statistics in healthcare sector. Eminent healthcare professionals, statisticians, and researchers have joined us to share their knowledge, experience, and innovative approach. I am confident that these interaction and intellectual discourse inspire the collaboration of the spark innovative ideas that will shape the future of the healthcare. I would like to extend my heartfelt appreciation of our chief guest and the chairperson of our R&D schemes, participant and collaborators who have extended their whole shirted support to make this event possible. Once again, I extend a warm welcome to each and every one of you. May this webinar be the transformative discussion and innovative ideas and collaboration effort to unlock the full potential of the statistics in healthcare. Together, let we increase the power of data, of the statistics, and create the healthier and more healthy future for all. Thank you so much to all, and once again, welcome to all. Thank you so much.
Thank you. Thank you so much, Dr. Shubham Pandey, sir. Due to some technical error, सीमा मैम अभी हमारे साथ ज्वाइन नहीं कर पा रही हैं. So, I would like to introduce the chairperson of Maharshi Charak R&D scheme, Dr. G.S. Tomar, sir. Sir is serving as the CRAV Guru at Rashtriya Ayurveda Vidyapeeth, Ministry of Ayush, Government of India. Sir is the former principal of Government Ayurveda College, Handia, Prayagraj. He has been awarded Fellow of Rashtriya Ayurveda Vidyapeeth FRAV by Rashtriya Ayurveda Vidyapeeth. He is the member of Technical Working Group Ayush and TEP collaboration with Government of India. He serves on the Executive Council of Mahayogi Guru Gorakhnath Ayush University, Gorakhpur. Sir has also served as the Dean of the Faculty of Ayurveda and Unadi Medicine at CSGM University, Kanpur, and as an Adjunct Professor of Kavya Chikitsa at the Faculty of Ayurveda, IMS BHU. With over 42 years of clinical experience, Sir has dedicated himself to serving humanity. His expertise and dedication have garnered recognition, and he has been honored with various prestigious awards, including the Shiksha Shri Award, Prayag Gaurav Samman, Kavya Pratishtha Samman, Dhanvantri Award, Excellence Award, and the 20th Century Scholar Award from Newark, USA, from his remarkable work. Now, I would like to invite Dr. G.S. Tomar, sir, to share the role of statistics in Ayurveda research.
Am I audible?
Yes, sir, audible.
ओम श्री सीतानाथ समारंभाम रामानंदादि मध्यमाम अश्मदाचार्य पर्यंताम वंदे श्री गुरु परंपराम। आज मुझे बड़ी प्रसन्नता है कि आज नेशनल स्टैटिस्टिक्स डे के दिन आज हम लोग एक ऐसे यशस्वी और ऐसे मनस्वी व्यक्ति की बर्थ एनिवर्सरी को आज एक नेशनल स्टैटिस्टिक्स डे के भी रूप में सेलिब्रेट कर रहे हैं। उसके लिए मैं साधुवाद देना चाहूँगा इस कार्यक्रम के ऑर्गेनाइजर डॉक्टर शुभम पांडे को, और विशेष रूप से मैं प्रणाम करना चाहूँगा, नमन करना चाहूँगा आज के चीफ गेस्ट, ये आपके जिनको हम कहते हैं विश्व पितामह स्टैटिस्टिक्स के हमारे भारतवर्ष में प्रोफेसर पदम सिंह साहब को, एडिशनल जो आपके भूतपूर्व एडिशनल डायरेक्टर जनरल ICMR में भी रहे हैं, और निश्चित रूप से एक इतनी सरल और रोचक भाषा में आप स्टैटिस्टिक्स को जनसामान्य के सामने रखते हैं। आपकी इस विशिष्ट प्रतिभा को मैं नमन करता हूं, प्रणाम करता हूं। हमारे साथ और विभिन्न संकायों से, डेंटल साइंसेज से, नर्सिंग से, और साथ साथ में होम्योपैथी से आचार्य साहब वगैरह सब जुड़े हुए हैं, सबको मैं प्रणाम करता हूं। और आज विशेष रूप से मैं ये बताना चाहूँगा, जैसा कि अभी हमारी मोहिनी जी ने आपके सामने स्पष्ट किया, कि वी आर सेलिब्रेटिंग बर्थ एनिवर्सरी ऑफ renowned statistician PC Melanovis on 29 जून एवरी ईयर। ये सेलिब्रेशन का तात्पर्य होता है कि ही इज द पर्सन हु इज इंस्ट्रूमेंटल टू इंट्रोड्यूस स्टैटिस्टिक्स एज ए सब्जेक्ट एंड हाईलाइटेड द इंपॉर्टेंस ऑफ स्टैटिस्टिक्स इन द प्रेजेंट सिनेरियो। इस परिप्रेक्ष्य में मैं बहुत ज्यादा मुझे प्रसन्नता है कि ये नेशनल स्टैटिस्टिक्स डे वाज एस्टैब्लिश्ड इनिशियली फर्स्ट सेलिब्रेटेड इन 2007 in India. World Statistics Day is celebrated on 20th October. Every 5 year, UN Statistical Commission के माध्यम से इसको मनाते हैं, और हम लोग जो है ये 29 जून को इनकी बर्थ एनिवर्सरी के दिन मनाते हैं। इस बार का जो थीम है, अलाइनमेंट ऑफ स्टेट इंडिकेटर फ्रेमवर्क फॉर मेंटेनिंग सस्टेनेबल डेवलपमेंट गोल्स, ये निश्चित रूप से ये प्रतिपादित करता है कि बढ़ते हुए जो कदम हमारे विज्ञान के हैं, और प्रत्येक क्षेत्र में, राइट फ्रॉम हेल्थ केयर टू एवरी फील्ड ऑफ द लाइफ, विदाउट स्टैटिस्टिक्स वी कैन नॉट मूव, बिकॉज इन द साइंटिफिक एरा वी हैव टू एस्टैब्लिश our facts on the scientific parameters. Everybody is interested to listen evidence based studies. तो इसमें बहुत ही इंपॉर्टेंट इसका रोल है, और ये मुझे बताने में बड़ी प्रसन्नता है कि ये कोलकाता को बिलोंग करते थे, और ही इन्वेंटेड रिवोल्यूशनरी कंसेप्ट ऑफ मेलानोवस डिस्टेंस। ही प्लेड इन्फ्लुएंशियल रोल इन डेवलपिंग द इंडियाज इंडस्ट्रियलाइजेशन प्लान इन सेकेंड 5-year plan. He also established the Indian Statistical Institutes in Kolkata in 1931. और ये महर्षि चरक रिसर्च एंड डेवलपमेंट स्कीम का चेयरपर्सन होने के नाते मैं विशेष रूप से बताना चाहूंगा कि इसका उपयोगिता स्टैटिस्टिक्स की हमारे फील्ड में क्या हुई, और जो शुरुआत की गई उस शुरुआत के जो परिणाम हमारे सामने आ रहे हैं, वो परिणाम निश्चित रूप से ये प्रमाणित करते हैं कि ये एक बहुत बड़ा एक रिवॉल्यूशनरी स्टेप था, जिसके लिए मैं बहुत साधुवाद देना चाहूंगा हमारे डॉक्टर शुभम पांडे को, कि इन्होंने प्रयास करके इस स्कीम को शुरू किया। तो आज हमारे प्रत्येक फील्ड में एक बड़ा ट्रायंगल हम लोगों ने तैयार किया, जिस ट्रायंगल में विशेष रूप से NIA डीम्ड टू बी यूनिवर्सिटी जयपुर, इसके वाइस चांसलर, ऑनरेरी वाइस चांसलर हमारे प्रोफेसर संजीव शर्मा जी, और हमारे CCRAS के डायरेक्टर जनरल डॉक्टर आचार्य जी, हम लोगों ने मिलकर के तैयार किया। हमारी इंडियन ये अप्लाइड इंस्टीट्यूट ऑफ दिस स्टैटिस्टिक्स, इन तीनों ने मिलकर ये कार्य शुरू किया, और बहुत अच्छी तरीके से ये प्रारंभ हुआ। आज इसको हमारे UG और PG स्टूडेंट्स इसका पूरा लाभ उठा रहे हैं। मैं आपके सामने विशेष रूप से कुछ फैक्ट्स को रखना चाहूंगा, ये बहुत लंबा एक डिस्कशन नहीं होगा। ये बताना चाहूंगा कि आयुर्वेद इज ए टाइम टेस्टेड साइंस, एंड इट इज सपोज्ड टू बी एज एंशिएंट एज द हिस्ट्री ऑफ मैनकाइंड, because Vedas are supposed to be the ancient most written testimony of knowledge. Being a sub-Ved of Atharvaved, the antiquity of Ayurveda is already proved. Then the important thing what I want to emphasize over here, every principle laid down by our Maharshis after thorough discussions and seminars and symposia and thorough research protocol. You just imagine, they have mentioned सिद्धांतो नाम यस्य सह परीक्षकैर बहुविध परिच हेतु विश्व साधयत्वा स्थापित निर्णय। ऐसा नहीं कि उन्होंने कोई भी चीज पढ़ी और अपने आप एस्टेब्लिश कर दिया, thoroughly discussed, और what are their instruments at that particular time they were having, the 4 pramanas are there. The beauty of Indian philosophy, Indian science, is supposed to be the wonderful thing, because every principle laid down by Maharshi is through 4 pramanas. They are the Aptopadesh, there is the literary document, Pratyaksh, direct observation, Anuman, inference, and this Yukti, that is rationality. इन 4 प्रमाणों के आधार पर ही उन्होंने सिद्धांतों को स्थापित किया. यही एक परिणाम था कि the principles laid down by our Maharshis are time tested and they are true even today. अभी आपने देखा, though I am not criticizing any system of treatment, because each and every system of treatment has got its own strength and limitations. But during COVID pandemic, we have noticed the journey of the Western medicine started from the hydroxychloroquine, ivermectin, azithromycin, remdesivir. Ultimately, they U-turn लिया. U-turn लेने के बाद what they have verified? They have discussed that immunity is only the way to protect the masses from the different type of the deadly diseases like COVID pandemic. We are talking about this approach right from very beginning. All the medicaments which are recommended by the Ministry of Ayush, they were having immunomodulatory effect. Giloy is immunomodulator, it was immunomodulator, and it will be immunomodulator. Because these principles were laid down on the 4 pramanas. So we are talking about the evidence versus praman. Praman is a wide entity. And evidence is a narrow knowledge. Evidence means direct observation. तो मैं ये बताना चाहूंगा, in spite of this, it is the need of the time to establish our principles on current scientific parameters. And we have to prove the evidence-based studies in front of the global community to convince them in their own language. That is very important in the present scenario. That's why statistics plays an important role to prepare the raw data into the conclusion. Concluding remark आपको देना होगा, और नतीजा ये हुआ कि now in public domain you can see more than 40,000 research papers were published by the Ayurvedic researchers, and they are available in the public domain based on the scientific observation and statistical data. तो ये सारी चीजें हमारे सामने आई. और दूसरी इंपॉर्टेंट चीज, हमारे महर्षियों की प्रारंभिक युक्ति यही थी. उनका कहना था कि परीक्षकारिणो हि कुशला भवन्ति. Those alone are wise who act after investigations. They played an important emphasis over this thing. The reasoning, experimentation, comparison, and judgment. ये उनका अपना सोचने का नजरिया था. Now the question is, what is the need of the research and statistics in the present scenario of Ayurvedic studies? To review and revitalize the classical Ayurvedic literature. That is very important, because the Ayurveda is not limited between the 4 walls of the country. Now it has become global property. Then you will have to convince them within their own language. Then to explore and popularize historical facts of Ayurveda. To develop evidence-based support for the efficacy of the Ayurvedic products. To generate data based on study, standardization, and quality control of the Ayurvedic products. To convince global community regarding efficacy of the Ayurvedic drugs. To standardize Ayurvedic lifestyle for prevention of the diseases and promotion of health. आपको जान के आश्चर्य होगा कि during COVID pandemic, our lifestyle is supposed to be very much popularized among the Western community. Now they are asking about the ब्राह्म मुहूर्त में उठने से क्या होता है, सवेरे ऊषा पान करने से क्या होता है. These things are very much popularized. तो हमको इन सब की स्टडीज भी प्रमाणित करनी होगी. एक सामान्य उदाहरण आपके सामने रख रहा हूं कि सवेरे ब्राह्म मुहूर्त में तांबे के पात्र में रखा हुआ जल पीने से क्या लाभ होता है. तो एक साइंटिस्ट ने जो वेस्टर्न मेडिसिन से एमबीबीएस स्ट्रीम से हैं, उन्होंने रिसर्च किया और दे फाउंड द फीमेल्स व्हिच आर हैविंग रिपीटेड यूरिनरी ट्रैक्ट इन्फेक्शंस, अगर वो तांबे के पात्र में रखा हुआ जल प्रातःकाल पीती हैं तो आपके रिपीटेड यूटीआई की समस्या से निजात मिल जाती है. दिस इज वन ऑफ द कॉमन वन एग्जांपल. इसी तरह से हमको साइंटिफिक डेटा प्रोड्यूस करना होगा जिसके ऊपर कंटिन्यूअसली हमारी फैटर्निटीज पे काम कर रही है और हम तेजी के साथ आगे बता रहे हैं. As far as the research methodology is concerned, we have got the scope of research in Ayurveda. They are the literary research, clinical research, फंडामेंटल रिसर्च एंड ड्रग रिसर्च, इनमें हम काम कर रहे हैं। दूसरी बात आपके सामने आप जो देखते हैं कि इंपॉर्टेंस ऑफ रिसर्च इन आयुर्वेद, ये आपके सामने सारी चीजें बहुत से हमारे फंडामेंटल्स हैं। वी आर टॉकिंग अबाउट द त्रिदोष थ्योरी, वी आर टॉकिंग अबाउट द पंच महाभूत, वी आर टॉकिंग अबाउट द सप्त धातुस. Several things are there. They need the standardization and explanation through the research methodology and modern statistics. तो उसमें डेटा प्रोड्यूस करने के लिए कंटिन्यूअसली all post graduation research centers are working hard to produce the literature in convincing the global community in their own language. हम देखते हैं कि हमारे यहाँ इतने, आपको जान के आश्चर्य होगा कि 5000 वर्ष पूर्व जब हम चरक संहिता पे ध्यान देते हैं, सुश्रुत संहिता पे ध्यान देते हैं, तो दे हैव डिस्क्राइब त्रिविध परीक्षा, दर्शन स्पर्शन प्रश्न ही, दर्शन परीक्षा इंस्पेक्शन, दर्शन परीक्षा स्पर्शन परीक्षा, नाड़ी परीक्षा देख रहे हैं हम लोग, ये स्पर्शन हो गया, प्रश्न ही क्वेश्चनियर, ये सारी चीजें अपने रिसर्च को वैलिडेट करती हैं। चतुर्विध परीक्षा, पंचविध परीक्षा, षड्विध परीक्षा, अष्टस्थान परीक्षा, दसविध परीक्षा, टोटल पर्सनालिटी ऑफ इंडिविजुअल कैन बी असेस्ड विद द हेल्प ऑफ द दसविध परीक्षा, because each and every individual has got his own constitution and temperament, and different type of the medication is given to each and everybody. Ayurveda is individual science. That's why how to analyze one's constitution and temperament, that has been given in the Ayurvedic literature. तो मैं आपके सामने अधिक समय न लेकर के ये बताना चाहूंगा कि हमको अपने सिद्धांतों को आज के परिप्रेक्ष्य में सिद्ध करने के लिए आगे बढ़ना होगा, और स्टैटिक्स इसमें एक बहुत महत्वपूर्ण रोल निभाती है। और बस मैं अंत में कंक्लूड करना चाहूंगा, द प्रायोरिटी ऑफ द थेरापेटिक शिफ्ट फ्रॉम द कम्युनिकेबल डिसीजेस टू द लाइफस्टाइल रिलेटेड डिसीजेस। और ये डाटा प्रोड्यूस किया गया है कि आयुर्वेद कैन कंट्रीब्यूट अ लॉट in the management of the lifestyle related diseases. They are the NCDs, and Ayurveda has tremendous potential in this field. और स्टैटिक्स के आधार पर हमको आज अपने उन सब चीजों के बारे में जो कि हमारी रिसर्च हमारी जगह जगह हो रही है, इसके बारे में बहुत अधिक काम हमारा आगे चल रहा है। और मैं बहुत बहुत धन्यवाद देना चाहूंगा आपकी महर्षि चरक रिसर्च एंड डेवलपमेंट स्कीम को फॉर्मुलेट करने के लिए, इसको स्टेब्लिश करने के लिए डॉक्टर शुभम पांडे का, और विशेष रूप से इंस्टीट्यूट ऑफ अप्लाइड स्टैटिक्स का, कि हम लोगों ने आगे बढ़ करके जो काम किया है, जो पायस वर्क किया है, इससे बहुत से लोग लाभान्वित होंगे। आज देश के कोने कोने से हमारे रिसर्चर्स जुड़े हुए हैं। उनसे मैं निवेदन करूंगा कि हमारे जो कार्यक्रम चल रहे हैं, 3 months डिप्लोमा सर्टिफिकेट कोर्स, इनमें आप बढ़ चढ़ करके हिस्सा लें, जिससे कम से कम स्टैटिक्स का एक जनरल आइडिया आपके सामने प्रोड्यूस किया जा सके, जो कि हमारे देश की उन्नति के लिए, हर क्षेत्र के लिए बहुत आवश्यक है। इन्हीं शब्दों के साथ एक बार पुनः मैं उस महापुरुष जिनका कि आज जन्म दिवस है, बर्थ एनिवर्सरी है, पीसी मेलानोवस को हम बहुत बहुत प्रणाम करते हैं, उनको बहुत बहुत नमन करते हैं, और आप सबको बधाई देते हैं कि उनके दिखाए हुए मार्ग पर इस क्षेत्र को, जिसके बारे में उन्होंने एक अपना बहुत बड़ा योगदान दिया, उसको आज के वर्तमान भारत में स्वावलंबी भारत बनाने की दिशा में हम लोग काम करें। बहुत बहुत धन्यवाद। जय आयुर्वेद, जय धन्वंतरी।
Thank you so much, sir, for sharing your views and experience with everyone. Thank you so much, sir. Now, I would like to introduce the chairperson of CF Samuel Hahnemann Homeopathic R&D Scheme, Dr. B.N. Acharya, sir. Sir has been practicing homeopathy since 1982 and currently serves as a director of Indian Institute of Homeopathy and Hospital in Kanpur, UP. They have had significant positions in their career, including the role of Director, Medical Wing at Abhinav Institute of Higher Studies, Kanpur, and lecturer at Pandit J.L.N. Government Homeopathic Medical College, Kanpur. Sir has served as a Senior Research Fellow at CCRH Government of India. They have served as a Chief Editor of International Medical Times and as an editor for prestigious publications such as All India Homeopathic Journal, Doctor's Voice, and E-Magazine Vision Kanpur. Sir has received numerous awards and recognition for their contributions to the field of homeopathy, This includes the American Gold Award in 1994, Man of the Year Award in 1996, Distinguished Leadership Award in 1997, and a Lifetime Achievement Award in 2018, among many others. Sir has contributed to the National Homeopathic Conference 2020 held in Lucknow and many more such events. Now I would like to invite Dr. B.N. Acharya sir to share the role of statistics in homeopathy research.
Thank you, Madam. First of all, I congratulate you all, and particularly Institute of Applied Statistics on this auspicious occasion of Professor Prashanta Chandra Mahalanobis, the legendary personality of statistics. Now I will like to throw some light on the today's discussion on health statistics. Usually, health statistics are used to understand risk factors for communities, track and monitor diseases, see the impact of policy changes, and assess the quality and safety of healthcare. It is concerned with collecting, analyzing, interpreting, and presenting data. It helps us to understand the general trends and patterns in a given data set. It can also be used for making predictions about future events and behaviors. Suppose if we want to see the result of many patients of same disease, we can summarize them into different groups according to age, sex, etc. World Health Organization states that homeopathy is the second most used medical system internationally with over $2 billion in expenditures for such therapy. According to WHO, homeopathy is the fastest growing and second most widely used system of medicine in the world. In India too, homeopathy is the second highest funded as well as used category under Ayush by the Indian government and public respectively. Budgetary allocation in India in health sector is maximum for allopathy. For example, in the year 16-17-2000, it was 37,061.58 crore for allopathy, where Ayush received rupees 1,326.2 crores for all pathies except allopathy. That about 3.58% of what allopathy receives. The government expenditure on Ayurveda is just a triple of homeopathic budget. Government data says that 28% people in India use one of the more kind of Ayush treatments. Now more than 100 million people depend solely on homeopathy. India leads in terms of the number of people having homeopathy than other Ayush systems. Use of homeopathy is steadily growing in India as per an analysis of Ministry of Ayush. This sector exhibited an annual growth of 26.3%, the highest among the other Ayush modalities. Now, the organized homeopathic medicine market in India is estimated more than 7,000 crores. Global market size is projected to reach US dollars 1,377 million by 2028. There are more than 3 lakhs homeopathic doctors, 10,000 homeopathic hospitals, government and public sector, 250 UG and PG homeopathic medical colleges throughout India. Here, education and practice of homeopathy is regulated by National Commission of Homeopathy (NCH), formerly known as CCH, Government of India. Homeopathic Pharmacopoeia Laboratory works on the standardization of homeopathic drugs. Likewise, CCRH, Central Council for Research in Homeopathy, is an apex research body under Ministry of Ayush. Government of India, which undertakes, coordinates, develops, disseminates, and promotes scientific research in homeopathy. CCRH formulates and conduct research programs, collaborate with national and international institutes of excellence to undertake evidence-based research in fundamental and applied aspects of homeopathy, monitor extramural researches, and propagate the research findings through monographs, journals, newsletters, seminars, workshops, etc. Now, studies comply with the modern scientific parameters, and research is undertaken with the goal that the outcome of research translates into practice and the benefits of research is extended to the proportion and the public. Now, overall, we can say that a homeopath is particular may analyze the patient's disease-wise, medicine-wise, age-wise, sex-wise, etc. and government or other institutions may formulate their decisions and policies for the benefit of homeopathic users according to statistical analysis. So the impact of statistics on decision making is very useful and very important. We at the Institute of Applied Statistics, we are now launching our Dr. CFS Hahnemann, who is the founder of homeopathy. In his name, we are going to start our research training, statistical research training to all the homeopathic colleges, students, doctors in market who is practicing homeopathy. We will teach them how to practice evidence-based homeopathy. Here is lacking in homeopathic fraternity, particularly in general practitioners. They, besides their busy schedule, they cannot in a position to keep the history of patients much more. And this is very important in homeopathy. We have to individualize each and every case, and we take the complete history, mental, physical, behavioral, his or her occupation, and overall we analyze totality of symptoms, and then we go for repertorization, and after repertorial analysis we reach to get our remedy for that particular patient. So individualization is a very essential on homeopathy, and this takes a long process. We should take the history and we should keep the record of each and every patient, so that it will help to assess the total prevailing ailing problems and what homeopathy medicines are doing particularly. So overall, we can say the impact of statistics on decision making is very useful and very important. At last, I bow my head before immortal soul of our great Indian personality, Professor Prashanta Chandra Mahalanobis, who gave us a wonderful tool to reach our goal to serve the humanity. Thank you all.
Thank you. Thank you so much, sir, for sharing your views and knowledge with everyone. Now, I would like to introduce the chairperson of Florence Nightingale Nursing R&D Scheme, Dr. Rajesh Sharma, sir. Dr. Rajesh Sharma, sir, is currently working as an associate professor and head department of critical care nursing at the Himalaya College of Nursing, SRHU, Dehradun. Sir is also the coordinator for the American Heart Association International Training Center and Simulation Skill Center of Excellence at Himalaya Institute of Medical Sciences, SRHU, Dehradun. Sir is serving as a secretary of the Uttarakhand branch of the Trained Nurses Association of India, TNAI. He is also a council member of TNAI headquarters in New Delhi. He has published 28 articles in various journals and has authorized 2 clinical record books for medical surgical nursing for BSc nursing students, which have been published by JP Publication in New Delhi. He has also presented papers at various conferences and seminars and has been recognized for his outstanding contribution to critical care nursing research. He has completed several research projects on various topics related to nursing and healthcare and received numerous awards and recognition for his exceptional work in the field of nursing education and research. Now I would like to invite Dr. Rajesh Sharma, sir, to share the role of statistics in nursing research.
Hello, good evening.
Doctor?
Yeah, I'm audible.
Yes, sir, audible.
Okay. Thank you for inviting me, and good evening to all. First of all, I would like to wish you all happy National Statistics Day on the occasion of Dr. Professor Prashanta Chandra's birthday. And I'm very thankful to Dr. Shubham Pandeji, who is the director of IAS and who has thought about the starting this Florence Nightingale Nursing Research and Development Scheme for the nursing personnels in India. I'm also very thankful for our governing committee chairperson for this scheme of for nursing research and development scheme, Dr. Lata Venkateshan. She is principal, All India Institute of Medical Sciences, College of Nursing, New Delhi. And I also thankful to the members, Dr. Poonam Joshi, Principal, AIMS, College of Nursing, Kalyani, Dr. Vaishali from Maharashtra, Dr. Elsha from Manipal, Dr. Ramu from Rajiv Gandhi Institute of Health Sciences, Bangalore, and Dr. Muthu from IBHAS, New Delhi, Dr. Sushil Maheshwari from Baba Farid Institute of Health Sciences, who have joined togetherly, and we are helping we are strengthening the hand of Professor Shubham Pandey, who is the director of this IAS, and who is the real instrument who is playing this for the development of nurses, and how the nurses can be more capable to provide the evidence-based care for the patients who are coming coming to the hospital. It's a high time to promote the research environment and inculcate the research aptitude of nursing in students of UG, postgraduates, and PhD programs. Vision behind this thought is actually inculcating the research aptitude among the students and the faculties. That's why we thought to extend this scheme, like Professor Subham discussed with us, that they want to introduce this scheme to this nursing as a Florence Nightingale Nursing Research and Development Scheme. Though before that also, on launching this Florence Nightingale scheme, before that also last 3 years we were running in many of the colleges. We have already organized this program, and many feedback we got that this is really helping the nurses. So within by this statistical workshop, they are learning a lot. And it is very important because we have seen that what the men what we can say that men the goal of this scheme is hereby is that to develop and apply the deterministic thinking effectively by conducting various educational training programs, workshops at different nursing colleges all over the country. The main goal of the scheme is to provide quality education through experienced and renowned national faculties from different prestigious organizations at minimal cost. Furthermore, the scheme is aimed to spread statistical knowledge to each and every organization across the country. So here, statistics plays a significant and great role in nursing by providing valuable tools for data analysis and decision making in healthcare. Here are some of the key roles and importance of statistics in nursing we can discuss about here. Some of points are here like where we can more utilize this statistics in the research and the nursing side. The research design and analysis, because statistics is very essential in designing research studies, including clinical trials, epidemiological studies, and outcome evaluations when we are delivering the care to the patients based on the documents which we are maintaining in the hospital. It helps the nurses to formulate research questions, determine sample size, collect and analyze the data, and draw meaningful conclusions from the results. And by this help of this statistics, nurses also can practice evidence-based practice in clinical side. Nurses rely on evidence-based practice to provide high quality care in the hospital. So statistics aid is evaluating research findings and determining the effect of interventions and making informed decisions about the patient care. Because it is also well known that almost time nurses are there around the patient 24 hours, and so nurses can play a better role, and which have been shown by the nurses in the COVID era also, because the award was given to the peace award was given to the nurse. Indira Gandhi award was given to the doctors and nurses jointly last year. It was a great we can say that it was a privilege for nurses. It was a great privilege for us that we got this award, because the nurses dedicatedly provided care to the patients. And now, based on the data, now nurses are doing many studies during the COVID, also done the many studies, and statistics really played a great role to analyze them. And so it allowed nurses to critically appraise the research studies, assess the strength of the evidence, and translate research into the practice. It also helps, studies also help the data collection and analysis, because nurses collect vast amount of the data, including patient demographics, vital signs, laboratory results, and treatment outcome statistics help in organizing, summarizing, and analyzing these data. So here, it also help in quality improvements and outcome evaluation. Statistics assist nurses in measuring and evaluating the quality of care provided. It helps identifying area for the improvement, because sometimes we do not know that in which area we are really lacking, in which area we are not able to provide the quality care. So by this research and by the formulating the questions, and after that analyzing through the help of the statistics, so we can really identify those areas. So by this analyzing data on the patient outcomes, healthcare processes, nurses can implement evidence-based changes to enhance the quality and the safety of the care of the patient in the hospital. It is also, nurses use a statistical method to assess the patient risk factors and predict potential outcome. So it is also help in this. So statistics also add in the determining the effectiveness of risk reduction measures and monitoring adverse events. Statistics also help in providing nurses with tools to assess population health needs and plan health promotion initiatives by analyzing epidemiological data. So nurses can identify prevalent health issues, target high-risk populations, and design interventions tailored to specified needs. Statistical analysis helps to evaluate the impact of health education programs and intervention on health outcomes. In the last, this statistics and research really, it is also helping us to preparing the policies and making the decisions. The statistics plays a really a great role, a vital role in healthcare policies and decision makings. Nurses can use statistical data to advocate for change in healthcare policies, support resources allocation decisions, and demonstrate the effectiveness of nursing interventions. It provides evidence for informed policy discussions, enhance healthcare plannings, and contributes to improving patients' outcomes. So what, and the last what I can say, in summary, statistics is a crucial in nursing as it supports evidence-based practices, research, quality improvement, risk assessment, health promotions, and decision makings by utilizing statistical tools and techniques. nurses really can make informed decisions, and they can really improve patient care, because all the most time they are with the patient. That's why they are, doctors also rely on the nurses, what nurses are giving the data. So those data are the real data, because they only interact 24 hours with the patients, and they really contribute to advancement of the nursing practices. And in the last, I would like to say this, the step which this IAS is going to take to start this research and development in the nursing area is going to make a boom, because nurses are doing research, even the UG also, PG also, many, but they are not doing that up to the mark. Not all, but many institutions, they are doing quality research, because like in the All India Institute of Medical Sciences, like in national importance institutions with having many this one College of Nursing, and even government of India, now they have launched around 157 nursing colleges in all over the India, because Prime Minister have this one seen that the requirement of nurses in India. So nurses should not be only for the care. Nurses also should be there how to improve the care. So I think this scheme is going to make a big role. The how we can make the quality care, effective care, and cost-effective care, so that every Indian who is in the route also, that who is living in the urban rural areas, they can get a quality care through the nursing. So I'm really thankful, Dr. Padam Singh ji also, because with his inspiration, Shubham Pandey ji have got inspiration and started this scheme, and we are very thankful for ICMR, for National Institute of Medical Statistics, and to Indian Institute of Applied Statistics for giving this opportunity and to starting this scheme. Namaskar, Hare Krishna.
Thank you. Thank you so much, sir, for sharing your profound views and invaluable knowledge with our esteemed audience. Thank you, sir. Now, I would like to introduce the chairperson of Rafiuddin Ahmad Dental R&D Scheme, Dr. Neeraj Agrawal, sir. Sir is currently working as an associate professor at Department of Pharmacology, Government Medical College, GMC Ratlam, and also a member secretary in Institutional Ethics Committee. He is also the former principal investigator in Jubilant for CT Phase 1 and BA and BE studies. Sir is having more than 18 years experience in the field of clinical pharmacology, medical ethics, traditional pharmaceuticals, and medical education and research. He had conducted more than 300 clinical trials, phase 1 and bioavailability and bioequivalence studies as investigator in pharmaceuticals. Sir has published more than 25 original research papers in various peer-reviewed national and international journals. Now I would like to invite Dr. Rajesh Sharma, Dr. Neeraj Agrawal, sir, to share the role of statistics in dental research. Please, sir.
Yeah, good evening, all of you. First of all, happy Statistic Day. It's my wish to all the statistician, and Dr. Padam Singh sir is there, who is well known and the great personality of sir. Good evening, sir. Namaskar, sir. And renowned personality of statistics in internationally, globally, and I would like to thank IAS Institute of Applied Statistics, Dr. Shubham Pandey, so inviting and giving the opportunity to start this R&D scheme. This R&D scheme, his name is Rafiuddin Ahmad Dental R&D Scheme. So actually, before this, the scheme is as parallel to the other scheme of IAS, like Dr. Padam Singh R&D scheme, which has been conducted more than 200 medical colleges in India, and I was part of that R&D scheme also, and very great results that we got whenever we conducted this scheme, not only for MBBS student but also postgraduates as well as faculty of the medical colleges. Then launching of in the Ayurvedic, and after that homeopathic, and now IAS Institute of Applied Statistics has been planned, and we have basically made a skeleton for launching this scheme. So as far as the research is concerned, so research and statistic is concerned, so everywhere is research is there. So we right from the formulating the research question to introduction to material method analysis and then conclusion discussion and conclusion. So in every steps of the research that can't be uh, uh, fulfilled by without with the is without the statistics. So in as far as the research and statistics is concerned, and if we are talking in reference to dental, so as today's date there are 324 dental college in India. Okay, and there are two courses. One is BDS, Bachelor of Dental Science, and second is MDS, Master of Dental Science. So the MDS course it is more or less equivalent to MD as far as the research is concerned. So there is a thesis part is there, and the dental course is as complicated as MBBS course. So there are all the 5.5 year course and the 3 years course for MDS. So this is why we have planned this scheme. The IAS thought about that. So there are compared to MD or medical college, the MDS students or dental students, they are lacking in field of research. Okay, and because of the main problem which exists, which lie especially in the statistic part. So now, because of this, so we are planning to launch this scheme, and definitely it would be very useful for the MDS students as well as dental students, because of research is always there. Whenever any clinician who sit in the OPD or to see the patient, where is IPD or do the surgery, every time if he or she focus on the research, so that would be grateful, that would be advantageous for the future generation. So definitely I am very grateful to IAS that they have given the opportunity to work with to launch this scheme, and uh, this is it's I definitely see the great future prospectus of this scheme. So thank you very much.
Thank you, sir, for sharing your insightful opinions and priceless expertise with our respected audience. Thank you, sir. Now, it is with great honor and privilege that I introduce our esteemed chief guest for this webinar. We are delighted to have Dr. Padam Singh sir, a distinguished personality in statistics, gracing us with his presence today. Dr. Padam Singh sir is a former additional director general at the Indian Council of Medical Research, Government of India. Sir has held many important positions in Government of India. He has been a member of National Statistical Commission (GOI) during 2006 to 9. He has served as additional DG ICMR during 1997 to 2004 and Director National Institute of Medical Statistics during 1987 to 1997. He has worked as Joint Advisor Planning Commission during 1979 to 1987 and a Professor of Statistics at Usha Institute at 1975 to 1979. He has worked as Joint Advisor Planning Commission during 1979 to 1987 and a Professor of Statistics at a Usha Institute in 1975 to 1979. He has also been awarded a Sankhiki Bhushan Award and is a Fellow of the Society of Medical Statistics. Sir is recently get Padam Ramakrishna Pandey Lifetime Achievement Award from Institute of Applied Statistics and Dr. T.V. Sukhatme Lifetime Achievement Award with 5 lakh cash prize from Ministry of Statistics and Program Implementation, Government of India. Now, I would like to invite Dr. Padam Singh sir for the shower of blessings in our webinar. Sir, please. Dr. Padam Singh sir, please unmute yourself.
Sir, please unmute yourself. Sir, please unmute. Sir, please unmute yourself.
उनको फोन करके कहिए डॉक्टर शुभम
Mohini, please check the issues.
उनको
Sir,
फोन
please
करके
left yourself and once again you join the meeting.
डॉक्टर पदम सर अनम्यूट करिए अपने को
सर मीटिंग को प्लीज लीव करके एक बार दोबारा ज्वाइन करें. यस सर, नाउ प्लीज अनम्यूट योरसेल्फ. अब आप अनम्यूट हो जाएंगे.
Okay, thank you now.
यस सर,
Okay.
प्लीज.
Now I am really thrilled that this important event has been organized by Institute of Applied Statistics. Now this is especially important for me. As you know, I have worked in Planning Commission, and while working there, I learned Maharani's model, two-sector model that was used from the second five-year plan, and with which, there was a focus on industrialization. And the quote of that time was, investment for today is consumption for tomorrow. And I am also privileged that when it was announced that we have to celebrate the birthday of Professor Maharani as National Statistics Day, it was in ISI, and this announcement was made by Pranab Mukherjee, who was the finance minister then. It was at ISI, and I happened to be the member and officiating chairperson of National Statistical Commission. It was in 2007. So that way, I feel privileged that I was part of that announcement, and I have also learned Maharshi model, which was used in national planning. Now, the organization of this event by Institute of Applied Statistics is very, very special, very special. And you have, organized all these stalwarts. And, I need not say that we were talking of evidence-based. For credible evidence, there is a role of statistics. And the role of statistics starts from very beginning, defining the research problem, then, coming out with the appropriate research design, which is to be used for that objective and the research question, data collection tools, the sample size, the method of analysis, and ultimately coming out with the inferences. Now, this is what we say, this is the role of statistics in, generating credible evidence. These days, I have been associated with medical research. Now, one good news for Ayurveda and homeopathy is that they need not be bogged down with the randomized studies, randomized clinical trials. Even if we do, real world studies, real world are only observational studies. And these observational studies, as per the latest guidelines, will be as good as RCTs. So let us forget about RCTs or clinical trials. So we have been practicing Ayurveda, we have been practicing homeopathy. Now it is the matter of, organizing the data in a scientific way. And, I happen to be invited for one of the discussions. If we have to plan a study to compare effectiveness of Ayurveda and homeopathy vis-a-vis allopathy for given ailment, how should we go about? And, the general question is, the general answer is, we have to plan an RCT. No. I think we have to go by cafeteria approach. Cafeteria approach is one who prefers to opt for Ayurveda, he will opt for Ayurveda, he will not go for allopathy. And so is the case for homeopathy. So what one has to do is, one has to define the inclusion criteria, inclusion and exclusion criteria, and consistent with that inclusion and exclusion criteria, we can recruit the subjects. That means as per the standard protocol of Ayurveda or homeopathy or allopathy. Let them treat those patients as per their own system. Now, only thing is, we have to collect the data on all aspects and ultimately with the outcome. So it is the treatment which is different. It is the outcome parameters which have to be common for all the, three systems of treatment. And then one can compare the outcome. So I think this is how we have to view, we have to compare. We have to do studies to compare the effectiveness of Ayurveda and homeopathy vis-a-vis allopathy. And we should feel ourselves that yes, we are more capable of treating. COVID has provided that evidence. COVID में जितना आयुर्वेदा और होम्योपैथी पॉपुलर हुआ, जिस तरह इस पर फेथ था लोगों का ज्यादा हुआ, that was not on allopathy. I mean, that is one has to remember. So this is just a word of advice from me, that let us concentrate on so-called real world observational studies. Real world observational studies are you collect the information the way you are treating your patients. That's all. You just compile the data and come out with the outcomes, how the outcomes are with your method of treatment. And that will be good enough for as a research. As to the role of statistics in research in nursing and dental health, I think these are two areas. I think nurses, they only manage the patient. They know more about what is happening in the treatment by all systems. And the medicos, they have to rely more on the nursing as a support. I am associated with Medanta. Now we are doing many projects, research projects, where nursing person is the PI. So this is something, you have to see that for many of the studies, the nursing staff could be PI for the project, and the medicos could be a co-PI. Now that is something which is emerging. And the lastly, by dentistry में भी भाई बहुत scope है research का. And I think there, the patient pool is different. Okay, their treatment pattern is different. Their outcomes are also different. So I think they have also to enter big way in research. तो research में एक problem होती है कि भाई जो भी बच्चे जो भी मेडिको बनते हैं, चाहे एलोपैथिक में, होम्योपैथी में, या okay, Ayurveda, even dentistry and all that, they branch off. उनको मैथमेटिक्स जो है छोड़ना पड़ता है हाई स्कूल और सेकेंडरी के बाद में. And teaching them biostatistics is not that easy. I think we have to teach biostatistics in their language. And हमारी जो there is a R&D scheme on my name, and we have been participating in the training programs for Ayurveda also. And I में भी किया था, BHU में किया था, and there was a good response when we interacted and we tried to explain the statistical concepts in their language. I think this was received very well. तो मेरी शुभकामनाएं हैं कि भाई रिसर्च विल प्रोग्रेस, और हमारे होम्योपैथी में, आयुर्वेदा में, डेंटिस्ट्री में और नर्सिंग में there will be more of contribution in the area of research, and statistics will take or will do its role in explaining how simplified the research could be, and without getting bogged down into the hi-fi that language. We have to make ourselves convey the things in a simpler way. And my best wishes, my blessings for all researchers, and I thank the organizers, Institute of Applied Statistics, for organizing this event on National Statistics Day. Thank you.
Thank you. Thank you so much, sir, for sharing your wisdom and enriching our knowledge with our expertise. Thank you, sir. Sir, Dr. Seema Dwivedi ma'am unable to connect with us due to network issue at their end. Ma'am shared her views and experience with us as a national coordinator of Maharshi Charak R&D scheme via recorded video. Can we share their video?
Yes, please. Yes, Kariye.
Thank you.
Namaskar. I extend my warm welcome to all the audience and dignitaries present here today on the auspicious National Statistics Day. As organizer, I, Professor Seema Dwivedi, National Coordinator, Maharshi Charak Research and Development Scheme, it is but our proud privilege to commemorate this day to the anniversary of Dr. Prashant Chandra Mahalanobis, father of Indian statistics, for his leadership and pioneering work in statistics. Friends, today we are enriched from all four directions by all the dignitaries present here today, covering all faculties and branches of medicine, including allopathy, homeopathy, Ayurveda, nursing and dental sciences. As I extend my warm welcome to our chief guest, Dr. Padam Singh, former Additional Director General, ICMR. I extend my warm welcome to Dr. G.S. Tomar, as I call him, godfather of Ayurveda, for his sincere hard work for overall upliftment of Ayurveda. He is chairperson, Maharshi Charak Research and Development Scheme. I also welcome Dr. B.N. Acharya, a renowned practitioner of homeopathy, working tirelessly for upliftment of homeopathy. He is chairperson, CF Samuel Hahnemann, Research and Development Scheme, Homeopathy. I welcome Dr. Neeraj Agrawal, Chairperson, Rafiuddin, Ahmad Dental Research and Development Scheme. He is a vivacious, multi-talented personality. I welcome Dr. Rajesh Sharma. He is Chairperson, Florence, Nightingale Nursing Research and Development Scheme, a majestic persona. Obviously, I would love to congratulate Dr. Shubham Pandey for his tireless effort for research and development in statistics. He is National Coordinator, Dr. Padam Singh Research and Development Scheme in Allopathy. I welcome you all for your tireless effort, really working hard in the arena of research in your respective fields. Friends, today we are very much enriched by all these majestic personas. Statistics has long been recognized as the language of data. It is through statistics that we make sense of the world around us, uncover patterns, draw meaningful conclusions. So, to the statistical community present here today, I want to express my deepest gratitude for your relentless pursuit of excellence, your dedication to analyzing data, developing robust methodologies and disseminating knowledge has been pivotal in deriving and driving progress and guiding evidence-based policies. In Maharshi Charak and Research Development Scheme, we have been working hard. It was introduced in March 2022, and in this short journey of few months under the chairmanship of Professor G.S. Tomar and the committee members, we have established 3 state joint training centers, one in IMSBHU, the second in NIA, Ayurveda College, Jaipur, the third in Himalayan Institute in Uttarakhand. So we have till date conducted 3 offline workshops and 1 3-month certificate online course on research methodology and biostatistics, which started off on 1st January in collaboration with NIA Rajasthan Joint Training Center, Institute of Applied Statistics Kanpur and CCRS New Delhi. In this training program, we have trained more than 1,000 professionals, Ayurveda professionals, and till date more than 1,500 Ayurveda professionals have been trained in research methods.
Invite Ms. Smita Shukla to deliver the vote of thanks to everyone. Please, Smita.
Thank you so much, Ms. Mohini. Esteemed organizers, distinguished chairpersons, respected chief guests, ladies and gentlemen. Greetings and a sincere welcome to everyone. I am honored and grateful to be here today to offer the vote of thanks on this momentous day. We have come together virtually to explore the significance of statistics in healthcare and how we can transform data into functional healthcare insights. First and foremost, I would like to express my sincere appreciation to the organizers of this webinar, Dr. Shubham Pandey sir, the National Coordinator of the Institute of Applied Statistics, and Dr. Seema Dwivedi ma'am, the National Coordinator of the Maharshi Charak R&D scheme. Your vision, dedication, and meticulous planning have made this event possible. The seamless coordination and efforts put forth by your team have ensured a smooth and enriching experience for all participants. Thank you for providing us with this platform to delve into the value of statistics in healthcare. I would also like to extend my heartfelt gratitude to our esteemed chairpersons, Dr. G.S. Tomar sir from the R&D scheme of Maharshi Charak, Dr. B.N. Acharya sir from the R&D scheme of C.F. Samuel Hahnemann Homeopathy, Dr. Rajesh Sharma sir from the R&D scheme of Nursing, and Dr. Neeraj Agrawal sir from the R&D scheme of Dental. Your presence and invaluable expertise have significantly contributed to the success of this event. Your profound knowledge in your respective fields has enhanced our understanding and inspired us to explore the potential of statistics in healthcare. Thank you for sharing your wisdom and for being instrumental in shaping the discussion. I would also like to express my deep appreciation to our esteemed Chief Guest, Dr. Padam Singh sir, the former Additional Director General, ICMR. Your participation and insightful remarks have added immense value to this webinar. Your vast experience and expertise in the field of healthcare statistics have been a source of inspiration for all of us. Thank you for enlightening us with your knowledge and for gracing this occasion with your presence. Furthermore, I extend my sincere thanks to all the participants who have joined us today. Thank you for your valuable inputs and for making this event truly interactive and engaging. In conclusion, I would like to once again express my heartfelt thanks to the organizers, chairpersons, chief guests, and all the participants who have contributed to this webinar. Your dedication, expertise, and enthusiastic participation have made this event truly memorable and insightful. Thank you for organizing and joining us in this enlightening discussion on unlocking the value of statistics in healthcare. Let us continue to utilize the power of data to transform healthcare into actionable and impactful outcomes. Thank you so much, and have a wonderful evening. Thank you, everyone.
Thanks, Smita. Now, this is the end of the today's webinar. Thanks to all dear respected chief guests, participants, chairpersons. Thank you so much.